Welcome back to Government at Work. We have with us the Chief Minister of Gujarat, Mr. Narendra Modi. Mr. Modi, I've been doing a series of programs for Government at Work, and in the course of this series, I've come across many self-activated officials at the district level. Now, what happens in our country is that the initiatives that these officials take, they remain very localized. But I found that in the case of Gujarat, you have got a Swanta Sukhai program to actually encourage people to take these initiatives. How did you hit upon that innovative idea?
When I took this responsibility in 2002, so I did one openness in governance. So I called all the secretaries and I had some 250 hours long workshop. So I gave them a free hand that according to your choice, whichever work you like, do one for your self-satisfaction, Swanta Sukhai. And whenever I go on tour, I always spare a time to see that what Swanta Sukhai he is getting. Because of this reason, I can also judge a person that his Swanta Sukhai is very, very limited. So now I have to upgrade his Swanta Sukhai also. So it gives me a strength.
And the initiatives taken under the Swanta Sukhai program, you make sure that they are adopted across the state to this Chintan Shivir that you have, which is a...
Yes, that is a unique project we are doing. Every year for 3 days, all my ministers, all my secretaries, we used to sit together, all collectors, DDOs, the junior most district level officers are there, some 250 from 5:30 morning to 10:30 night. We have a tight schedule. We are calling from different officers from the different states. Last time we called Nagaland Chief Secretary. So the whole 3-day conference is based what is good. We don't discuss what is bad, what is lacking. When we are talking about the good, naturally we can eliminate the bad things. This is the way of working.
How do you make sure that these initiatives taken under Swanta Sukhai, whether it is the Jan Seva Kendra or the kitchen gardens attached to Baroda Anganwadis, how do you make sure that once the official is posted out, they continue?
What happens, what I said, that whomsoever taking this Swanta Sukhai project, he must create a team. Not only a work, he should create a team. Even after going from there, and not necessarily that team should be from the government employees. Local village people can be a part of the team and institutionalize your ideas and leave it, let them do. That will strengthen the society. That is the basic idea.
So earlier on in the program you mentioned that your emphasis is on human development. Now I understand that Gujarat is one of the most economically progressive states, though before the time you took over the state had gone into a bit of decline, but now it has regained some of that momentum. But we find that as far as social indicators are concerned, the state is not doing too well, and according to the latest National Family and Health Survey, the number of malnourished children in the state is about 47%.
The figures which you have are 2005-2006.
Yes.
But we have started the scheme in 2005. So now these results will be there. I don't want to blame the previous governments, but of course I'll have to bear the burden, and I'm ready to bear the burden, but I'll find out the way and will come out from these problems.
Even when it comes to infant mortality rate, the number of deaths of babies in Gujarat at 54 for every 1,000 babies is quite high compared to the national average of 58 per 1,000 babies, who die before the age of 1. Now you have started this Chiranjeevi Yojana program. What kind of a dent is it likely to make?
It's a very interesting thing. In this Chiranjeevi scheme, the below poverty line mothers, they are the beneficiary. Some 2 lakhs delivery were happened. If this Chiranjeevi scheme would not have been there, then what would happen? We must have lost more than 500 mothers and more than 5,000 children. But because of this scheme, only we lost 50 mothers, and we lost not 50 even, 30-35 mothers we lost, and only 700 children we lost. So we could save the life of the mothers, we could save the life of the children, and nowadays we are in first 3 numbers in the country, where we were the last 3 in the country.
The health experts that I spoke to, they are saying that by following this model, you are actually neglecting the state healthcare system.